We let 26,000 individuals die every year because of how expensive the current healthcare system is. Medicare for all is a huge deal, and not only in America, but also in Europe. Most popularly presented by Bernie Sanders, it has gained a large amount of attention in politics. It has been a huge idea and debate at the same time. Also, it has been talked about by both Democrats and Republicans. Democrats say it could be helpful to our government and health system, and in the long run would end up costing less. Republicans say it's a waste of money and it would increase taxpayers to an uncomfortable amount of tax dollars. This document will show you the benefits of Medicare for all and how it could not only help our government save money, but also save many more lives. Medicare for all would lead to a healthier America because more people will have access to life-saving treatment. Because of Medicare for all, more people would seek out Medicare, improving the health standard of America. Medicare for all would lead to a healthier America because people would have access to life-saving medications. Medicare for all people would no longer be charged insanely high prices to get the medicine that they need. Along with that, people will be able to get life-saving surgeries without completely playing themselves over. People will be able to get organ transplants, blood transfusions, and more without being thrown into financial debt for the rest of their lives. The general outcome of healthcare would be better. Because of Medicare for all, the outcome of surgery and death rate would overall be improved. 26,000 people die a year just by the lack of healthcare. This is horrible knowing that it's just for the fact they don't have any healthcare. People die just for the simple fact that they don't have any money or health insurance. Many undocumented people that come to America for a better future for their generations are scared and dying at home just for the facts they don't have any Medicare or no one will take them in. Medicare for all would lessen the overall health spending. Some advocates have said costs will actually be lowered because of the gains in efficiency and scale. Patients and private insurers would spend far less, and the federal government would pay far more. As we speak, individuals and employers pay insurance premiums, for instance, paying cash co-payments for drugs, and state governments pay a share of Medicaid costs. In this system of Medicare for all, nearly all of that would be replaced by federal spending.
Just ahead of a campaign event in New Hampshire, Joe Biden
just let me play this little clip.
Took a moment to hear a question from Sarah Boyd, a Democratic voter and college student in Pennsylvania.
How are you going to make sure that if someone has conditions or pre-existing conditions or anything like that, that they can trust that their health insurance, whether it's publicly or privately funded, will protect them and care for them?
My plan calls for taking Obamacare and building on Obamacare, restoring all the cuts that the president made, making sure that the 160 million people like that young lady who asked the question, if they like their private plan, they can keep it. Unlike Medicare for all, where they have to give it up.
Biden calls for increased subsidies so more insurance plans cap out-of-pocket expenses at $1,000 a year, for the government to limit prices on prescription drugs, and for a public insurance option for all who choose it.
Now, it does cost. It costs about $750 billion over 10 years, but doesn't cost $33 billion or $1 trillion,
right,
which the other plan calls for.
Yeah.
And it can be done immediately. Nothing missed between the cup and the lip, as my mom would say.
How would the public option work? Can you just give me some bare bones?
Yeah, I'll give you bare bones.
Work?
Public option is you say, I don't have enough money to buy into this plan. I don't have enough money to buy into it. So, of course, the gold plan. Well, here's the deal. I don't have any money at all. Are you eligible now for Medicaid? Well, if you are, you're in.
Medicare for All would be too expensive to enact. Medicare for All would be too expensive unless we raise the taxes for everyone. Some families that earn about $58,000 would be paying $5,000 a year in taxes. Biden also argued that this plan for Medicare for All was fiscally irresponsible and would require the federal government to raise taxes. Specifically, he claimed this plan, and I quote, would cost more than the entire federal budget that we spend now. In conclusion, Medicare for All would benefit not only the health system by helping save trillions of dollars, but also helping responsible and would require the federal government to raise taxes. Specifically, he claimed this plan, and I quote, would cost more than the entire federal budget that we spend now. In conclusion, Medicare for All would benefit not only the health system by helping save trillions of dollars, but also helping with the debts of many citizens. With your help, we can make this system work and save countless lives before it is too late. Vote for a politician who supports Medicare for All.